Live now to Pretoria. COVID-19 infection numbers seem to be getting better in Tshwane. Officials are recording up to 200 daily infections, down from 2,000 a month ago, if I recall. But it remains a hotspot area here in Gauteng. Today, officials are focusing on COVID-19 education, screening, and also testing in various parts of Tshwane. And on top of that story for us is eNCA's Barry Bateman. So, Barry, it was considered, as I mentioned a moment or two ago, a hotspot about 4 weeks ago, but things have changed.
Yeah, good afternoon, Jeremy. They've changed quite dramatically, and you touched on those figures too. On the 7th of January, they were looking at 2,000 new infections per day, but about 2 weeks ago, we saw a significant decline. They're at about 200 new infections a day. The MMC for Health, I was speaking to him earlier today at that outreach program, puts it down to a number of factors, one being the lockdown that we had since towards the end of last year. But he says another aspect that has come into play, which he believes is an impact, is that it's hitting a lot closer to home. Far more people are being touched by the COVID-19 pandemic. Either they know a family member who has died as a result of being infected, or know somebody who is seriously ill. So those are the aspects. He says there's a heightened vigilance from members of the public. He's seeing a lot more adherence, at least in Tshwane, to the various rules and regulations, such as mask wearing and adhering to those protocols of social distancing. So as a whole, although we do still have hotspots, which is why they were out today, as a whole, the city of Tshwane is in a much better place than it was just 1 month ago.
And that is good news, Barry, but you'll also tell me that some areas remain a concern for city health officials. So how are they identified, and once that happens, what services are put in place?
Yeah, I was given quite a lengthy explanation for what they're relying on. The city of Tshwane has got quite a sophisticated statistics program that it's running, keeping a very close eye on the various regions and wards in the city. What they're doing is, on a week-by-week basis, they're able to identify the top 10 and the top 5 areas which have got the highest infection rates. Those top 5 will then be visited from the Monday to the Friday by a mobile clinic which provides the screening and the testing services on site for those people in the particular area who might not be able to reach their local clinics or their hospitals, or have not been able to go to their doctors. Those remaining from number 6 to 10 areas in the hotspot, they send out teams who provide an education service. So being able to educate the people on the various requirements of the lockdown legislation and the mitigation, such as the mask wearing, hand washing, and so on. So there's that education aspect, but there's also that targeted screening in the particular areas that have been affected, and that, they also believe, is one of the driving factors in bringing down the numbers.
Barry Bateman in Pretoria.